Well, today we are talking all about pelvic health. We've got Jill Howell. She is a physical therapist here at Trinity, and you specialize in this. So let's talk about what pelvic health is.
Well, pelvic health or pelvic floor therapy is a group of muscles, and it helps structure the bladder, the bowel, and the reproductive organs. And we use those muscles to strengthen to help support those structures.
And let's talk about why it's so important to have strong muscles in that area.
It is so important to have the strong muscles in the area, so it helps keep things where they need to be in place. So we don't want things falling out, or we don't want leaking or any of that kind of thing, or increased pain in the area.
Okay, so let's talk about what your day is when you're working with someone dealing with pelvic floor issues. What kind of therapies you take them through and how it can help them.
So we treat things for pelvic pain, like muscle spasms, post-traumatic birth things, and endometriosis. We also treat muscle weakness, so incontinence. We also have urgency and frequency and retention as well we treat, as well as defecation issues. So you can either leak fecal or you can have constipation.
Okay, perfect. And so let's talk about how therapy can provide, a relief for a lot of these symptoms. I mean, these are things that, people wouldn't have to have surgery for or things like that if they can find relief through you. Let's talk about what that looks like.
So what we do is we go through an extensive exam and find out what exactly is your problem, and then we'll either treat it, like if you have a muscle spasm, we'll do trigger point relief stuff, some manual therapy, some tactics that way. We also will do a lot of education on the bowel and the bladder because 90% of it is education. And then we'll learn how to do strengthening of your core, your hips, and your back muscles.
Okay, perfect. And so how would, are you dealing with men and women? Are both people, or is this only women?
We do have a couple of our therapists are trained in men, okay, but we typically see just women. Okay. We do get some kids as well that come in for pelvic floor therapy, like your bedwetting kids and stuff like that, and fecal incontinence as well. Okay,
perfect. And so how would someone be able to access you for this type of care?
So we ask that you go through your PCP or your OB/GYN and get a referral, and then it will get uploaded into our system, and then we will call you for an appointment.
All right, and let's just go down the list again of, all of the symptoms that somebody might be experiencing that would, take them to you for therapy.
So the biggest symptoms is the leaking, the urgency, the frequency with bowel and bladder, both of them, pain, pelvic pain, pain with intercourse, pain after birth, those kinds of things.
Okay, perfect. So they just need to check in with their doctor and hopefully get a referral to come see you. Mm-hmm. Wonderful. And what kind of success rates do you guys see?
We see a very good success rate with our patients. Most of our patients have 100% success rate or 90% success rate.
That's an A, solid A there. Mm-hmm. All right, Jill, thank you so much for your time.
Mm-hmm. Thank you.